Yeah, it's certainly a new world for everybody in the medical field and indeed across the world. Meantime, I know that you're also working on another area of medicine, which is kind of trying to understand how this is rippling through the broader system. I know you've done recently some work specifically on telemedicine and visits to doctor's visits. What's happening to going to the doctor right now? Because your typical patients aren't your patients right now. You're dealing with COVID. What's happening to typical patients right now in the midst of this pandemic?
Yeah, so one of the most remarkable aspects of this, and we can go into a little bit why, but we're just seeing a dramatic change in the number of patients who are coming in for their doctor's appointment. So we have roughly 1 billion doctor's appointments a year in the United States, but we have seen, and it's just this precipitous change. Everything was kind of moving along normally in early March, and then within the span of 2 weeks, we've seen a 60% decline in visits in total to doctors' offices. That's particularly true and it varies a little bit by specialty, it varies a little bit by geography, but the overall picture is a tremendous decline in the number of visits that people have to doctors' offices. And we can understand why, on the doctor side, why are we trying to discourage patients unless absolutely necessary? We don't want them to become ill. We don't want our doctor's offices, our hospitals to become the place where they became ill. They were healthy and then they came in and they got exposed to someone else. And let's be very clear, the patients who are most at risk are the ones who have the most doctor's appointments, right? So our older adults, those with chronic illness, those who are immunosuppressed, and we want to keep them home. And also on the patient side, they see the news, they recognize this, they are scared to go in. And that combination of factors has led to this tremendous decline. The two things we're really worried, go ahead, yeah.
I was just going to say, I know you're an expert in telemedicine. Is telemedicine, I know we've done that with our family. We've had some appointments by telemedicine. Is that bridging the gap?
Yeah, so one of the things that is, I think, a silver lining of this horrible pandemic that we have is that there has been this really rapid change in telemedicine. So both in the United States, what I was studying in Australia was the rise of telemedicine and how it had been spreading. And while it had been having significant growth, it still was not the norm by any means. Within the span of a month, it has become the norm in both the United States and Australia and worldwide, or at least has become extremely common, I should say. What we found here in the United States is now, at the same time there was that decline, a very rapid and a large uptake of telemedicine by providers of almost every stripe. And one of the most remarkable numbers that we found was that 30% of all the visits that now are there happening are via telemedicine. Something that would have taken a decade to happen, all happened within the span of weeks.
Any tips that you have from being an expert on telemedicine for people as they have those calls, those telemedicine calls with their healthcare providers?
Yeah, one of the big messages that we're trying to express here in the United States is that I don't think that even though we're having a lot of telemedicine visits, the American public doesn't know about it. And so one of our messages out to the American public, and I think the Australian public and anywhere else in the world, is that this is something that can happen, and a lot of health systems have embraced this. I think right now people are just scared of like, oh, I can't go to my doctor's office, therefore I cannot get care. And one of the things that I really want to emphasize to that, Sarah, and you might have seen this in the news, is that we're seeing a high level of concern in the medical community about strokes, heart attacks, and other complications of chronic illness where patients are not coming in to see us. And we're afraid that they're suffering at home and unfortunately possibly even dying at home because they're scared to get care. And we have to emphasize that, yes, we know there's a pandemic, but if you're having a heart attack, you still need to come in. Or if you're having a complication of your chronic illness, you need to see your doctor. And then the other... And then we're also trying to work with practices, both here in the United States as well as worldwide, to try to emphasize how do you embrace this technology? How do you use it effectively? We're, again, just to emphasize, Sarah, that one of the things in the healthcare system, we don't move very quickly. And yet then again, within the span of weeks, there was this dramatic change, I think unprecedented change in how care is being provided. And I think practices individual clinicians are just still catching up. And so we need to really educate them on how to use this technology effectively.
And as we close, another aspect of this that occurs to me is that there is this huge impact on the health sector. On the one hand, you're bursting at the seams in hospital, but you're also telling me that doctors' offices, it's shrinking the population of people that you're seeing. What's the impact of that going to be on the health system going forward?
Yeah, a number of people have contacted me because they're confused because, again, as you articulated, there's this weird paradox we have, which is that on one hand, we're seeing so many people ill in the United States, but at the same time, we're having tremendous layoffs within the healthcare industry where outpatient practices as well as hospitals are furloughing people, firing people, and there are a lot of concerns about practices going bankrupt and closing. And the reason that is that while we have all these patients who have COVID, so few patients are coming in for all the other things that we do in the healthcare system, from elective surgeries to dermatology appointments and all those other things, that's what's led to this tremendous financial strain, both on hospitals as well as practices. And that's a thing of active policy debate, because if all these practices close, we're going to have a big problem post-pandemic, because in particular in rural communities as well as in lower income communities, if we lose those providers, then the access problems that already existed before the pandemic are going to get that much worse.
I should ask you one final question. You went into medicine, you could never have anticipated something like this. Knowing what you know now, would you still encourage young people to go into medicine, whether it's being a doctor or a nurse or some other healthcare provider?
No, I definitely think so. I mean, it is a really remarkably rewarding experience. I'm just thinking about the experiences I just had. I was on service through just a couple of days ago, and being able to care for patients at that time of real vulnerability, real need. And it's a privilege that way. So if you're interested, I think it's a great career.
All right, Ateev, thank you so much. We really appreciate that you could find time to join us. We hope you stay safe, and we're sure that your patients appreciate you even more than we do.